We're joined by Democratic nominee for Commissioner of Insurance, Wayne Goodwin. Mr. Goodwin, thanks for being on for this conversation.
My pleasure. Thank you for having me.
Well, let's look at your resume here. You're, I think, State House. You've been chairman of the Democratic Party in North Carolina and are, as of right now, former insurance commissioner. You're positioned to run for a variety of seats. Why insurance commissioner again?
Well, my work is not yet done. Whenever I concluded serving last, I'd served 2 terms, 8 years, and on my watch I'd saved consumers $2.4 billion, ordered historic refunds of $206 million, and we need somebody fighting for access to affordable health insurance. So my work isn't done yet, and I don't believe in leaving a job unfinished. So that's why I'm running for a 3rd non-consecutive term as our North Carolina Insurance Commissioner.
You're not the first Democratic candidate that I've interviewed saying they want to fight for affordable health insurance. Are you talking about Medicaid expansion?
That is part of it. And in fact, I would suggest the only candidate who has the most involvement with the ability to have access to health insurance, to affordable health insurance, as the insurance commissioner. Medicaid expansion is something I fully support. Some folks say, well, you're not in charge of regulating Medicaid. Well, here's the reason that I'm for it, among many, is that if we provide access to Medicaid expansion to cover 700,000 plus North Carolinians, and if they go uninsured, that causes the health insurance for everybody else to go up. It also provides tremendous savings for the state, and it's just the right thing to do. So I do support Medicaid expansion, and I will continue to fight for that.
Now, I've been around too long, Mr. Goodwin, to think that the insurance commissioner can unilaterally expand Medicaid. So you've got a bully pulpit over there. How do you convince the General Assembly to go along? And let's face it, the economy not doing too well right now. We don't know where state revenues will wind up next year.
Well, a couple of points on that is that I was the insurance commissioner when the Affordable Care Act was passed, and I was mandated by that federal law and for a long time by state law to help implement the Affordable Care Act. And part of that was how do you mesh Medicaid expansion with the implementing the Affordable Care Act. And even though it's not something that I can snap my fingers and make happen, what I would tell legislators is what I told them back in 2011 and 2012 and 2013 is that we need to expand it because it will keep everybody's health care costs down. It will provide greater opportunities for doctors in rural communities to keep their doors open and hospitals to keep their doors open. And it's just the right thing to do. Lower uninsured numbers in North Carolina help everybody. And really, it comes down to this. Most folks respond to dollars and cents. The federal government provided monies for this, and because we have not expanded Medicaid, North Carolina and North Carolina taxpayers have shipped $22 billion to other states that would have come here for Medicaid expansion. Those are our tax dollars. So we need to do what other states have done. I think 39 other states have expanded Medicaid. It's the right thing to do.
Staying on that line, obviously a big part of your platform, Medicaid expansion or more affordable health care. Can you get there without Medicaid expansion? And if you can, how?
It's extremely difficult to get to accessibility for affordable health insurance if you don't have Medicaid expansion, because the population of North Carolinians that earn too much money to be on current Medicaid rules, but not enough to purchase private health insurance, if we ignore Medicaid expansion as one of the tools in the toolbox, you're going to leave, a growing number of North Carolinians uninsured completely. I mean, it was 500,000. With the pandemic, the numbers now are closer to 650 to 700,000 North Carolinians. It's got to be a tool that we use for North Carolina. Now, there are other things too. There are statutes in our books that we need to amend to help us attract more health insurance carriers here. We have one big one, and a lot of other ones that cover different parts of the state. So that's what I would tell legislators is that we need to amend our laws to help attract more insurance carriers, but that if you are serious about health insurance for everybody, you have to expand Medicaid.
Does Medicaid expansion help or hurt efforts to recruit private insurers into North Carolina?
It would help. I mean, in many respects, because, we have right now, whenever somebody goes to the hospital, they have to treat someone, even if they're uninsured, and the cost of that uncompensated care gets factored into health insurance rates that private carriers charge as premiums to policyholders such as you and me and everybody else. So expanding Medicaid does not cause any problem with disincentivizing carriers to write private coverage here at all.
Let's talk about there's other insurance out there that gets people's attention. You know, car insurance every 6 months, homeowners insurance every year. What's the shape of our insurance industry right now, protecting our homes and our drivers?
Well, the question I'll ask is, do folks feel like that they are better off now with their health insurance, their auto insurance, their homeowners insurance than they were 4 years ago? I bet they're paying more for car insurance. I bet they're paying more for homeowners insurance. Historically, we've had fairly low automobile insurance, but on my watch, during my terms as insurance commissioner, we achieved something that hasn't been achieved before or since, is that we had the lowest average car insurance premiums in the entire country. And that's something that people enjoyed having. We need to get back to that. People care about what they pay for their car insurance. We don't need to have rates jacked up because you have a young driver. There's been proposals to try and increase it from 3 years to 8 to 9 years before your rates go back to normal. That's wrong. So the state of auto insurance is that people are paying more right now, and if I'm reelected to a third non-consecutive term, I will fight to get back to where we were, which was the lowest in the country. Homeowners insurance, we're a coastal state. It's a constant battle to make sure that carriers will continue to cover the entire state. And on my watch, the last official act rejected completely the homeowners insurance increases the industry sought, and it saved North Carolina homeowners $600 million. We haven't had that in the last 4 years. We need somebody who's fighting against improper and really numbers that don't support homeowners insurance increases. So we can do much better, and that's what I propose to do if returned as our state insurance commissioner.
But how do you balance a rate request increase or premium increases across homeowners and car policies? How do you view one as legitimate versus illegitimate? Because we may not want a premium hike, but we do want insurance options in North Carolina, and at some point they pull out.
That is a great question. It's a balancing act, and it really comes down to this. You need an insurance commissioner who understands the complexities of insurance rate making. I've been a hearing officer. I'm the only candidate in this race that's actually been the judge, the hearing officer for rate making for auto insurance and homeowners insurance and the like. And you have to have a good and vast knowledge of a lot of things, but also know who to call on as experts. So when it comes down to this, is that you have to have the skill, the ability, understanding of the law, and know which experts to call on to decide, okay, actuarially, is the insurance industry requesting something that is unacceptable, that is not borne out by the numbers, or is it something that does have the support of the math? It's about math, it's about science, and frankly, one of the guiding policies during my 2 terms as insurance commissioner is that we need to protect consumers. We don't need to have year after year after year of increases. You need to spread things out, and if the data supports an increase, make sure that it is as low as legally possible so that you have insurance companies willing to write here, but also you're not causing consumers to pay something they shouldn't have to pay.
How much of that is subjective opinion based on the commissioner in office at any time versus objective fact?
A great bit of it is objective, but I think it comes down to the ability of the insurance commissioner to determine what is in the best interest of the state, what's in the best interests of the consumers and of the insurance market. As I said, it is a balancing act, and there are times when you have to adjust rates upwards and downwards. And I'm the last commissioner to order on auto insurance significant refunds. I mean, we're talking about at one point it was $50 million in refunds to 1 million drivers. So a large part of it, significant part of it, I would say most of it, is based on objective data. But you got to be able to understand that data and understand what the law of North Carolina allows for rate adjustments. But there is a component of it where the commissioner can say, you know what, this is the wrong thing to do versus this is the right thing to do. And that's why I rejected completely the homeowners insurance increases that were sought in 2014, 2015, 2016, because the data did not bear it out. And the courts of the state actually justified that decision.
What concerns do you have for the health of our insurance industry right now? We know you're a man of the people. You're saying we're going to keep rates low. Yeah. Size up the industry as a whole across the state. Hurricanes haven't hit us yet, but they're coming sometime in the next year or so.
Well, and this is something which, another reason why I believe that returning to this office is important. When I was first elected in 2008, the issue was the ticking time bomb of coastal homeowners insurance. And working with legislators, consumers, insurance agents, everybody, listening to all voices on this, we were able to put together a legislative solution that stopped the ticking time bomb of coastal homeowners insurance. That was ratified in 2009. Okay, we're now 11 years out, and I believe that we need to update that law because we have more storms now. We have more dangerous storms now. The cost of rebuilding homes is different now than it was before. And there's so many other dynamics that weren't in play when the law that I supported was passed in 2009. So that's what one of my to-do list items is, to go back in and update the law so that we protect homeowners statewide. We make sure that the insurance industry will continue to write homeowners insurance, and that we're ready for the next series of bad storms.
We have about 90 seconds left. I want to switch gears off of insurance. You're the state fire marshal, and in that, where you would be in this position of insurance commissioner, you're going to work with our volunteer firefighters and first responders. What are they going to get in you that they're not getting now?
What they're not getting now is a state fire marshal, an insurance commissioner that supports cancer coverage for firefighters who develop occupational cancer. We're like the last state in the country. It is shameful that we don't have an insurance commissioner fighting for our firefighters to have cancer coverage when they develop cancer on the job. The number one killer of firefighters is not fire. It's not heart attack. It is cancer. And yet we don't have an insurance commissioner that has made that like the priority issue. That is why I have the support of the professional firefighters and paramedics of North Carolina. And that's what I bring to the table as our next state fire marshal and insurance commissioner. I'm fighting for our firefighters.
This is Wayne Goodwin, the Democratic nominee for North Carolina Commissioner of Insurance on the 2020 ballot. Mr. Goodwin, always good to see you. Thank you for coming in and sharing your platform with us.
Thank you. My pleasure.